Today I'm going to talk about respiratory distress or asthma in school-age children. National statistics show that 26 million people in the United States have asthma. Of those 26 million, 7 million are children. The diagnosis of asthma is on the rise due to better diagnostic testing and the skills of the practitioners. Asthma does have a familial tendency. Asthma is the leading cause of school absenteeism. Approximately 10.5 million school days were missed in 2008 related to asthma. Some other information about children in school age: 50% of the African American children are diagnosed with asthma. Of those 50% of African American children, the majority are males. And because they're males, they have a higher death rate related to asthma. In Lubbock ISD, we have approximately 28,000 students that enrolled from pre-K to 12th grade. Of those 28,000 students, 9,000 have asthma. And that's per our student health history that the parents fill out every year. So with that being said, and we're talking about increased absenteeism related to asthma, we have approximately 200 to 300 students that are absent per week per campus from the school nurse. In addition to that, there's approximately 100 to 200 more students that have unexcused absences related to asthma. That means their parents called in or they just didn't come to school and they said it was related to their asthma. So that's a total of anywhere from 300 to 500 students per week per campus that's related to asthma. Some facts about asthma: it's a chronic lung disease. It inflames the lungs and it narrows the airways. Sometimes the symptoms can be mild and they'll go away, or they'll be mild and you have to give a minimal amount of treatment. Sometimes even though you've given the treatment at school, the symptoms tend to be worse. So the information or the importance that we have to do here is you need to treat the symptoms when they occur. Don't think that they'll go away. Don't think that, oh, it's just, I'm stressed right now. You need to go ahead and treat the asthma. Asthma, there's no cure for that. There are some generic and environmental interactions that cause asthma to flare up. One thing that I found was interesting, that was young children, when they're first born, if they have wheezes and they have respiratory infections, they have a higher tendency to get asthma as like a middle-aged child or as an adult. In the children, in the school-age population, boys tend to have asthma more than girls. In the adult population, girls or women have asthma more than boys. So we're talking about asthma, and I thought it'd be a good way to show you a picture here. When you breathe in through your nose and your mouth. You go down the trachea, the larynx. Here's your airway. Branches off to your right main stem, which goes to the right lung. The left main stem, which goes to the left lung. Here is an airway that is normal. You have the smooth connecting tissues. You have the muscles. The lining in here is all clear and pink. Different way to look at the airway. It's nice, big. The muscles are relaxed. When a child has an asthma attack, the muscles on the outside, they constrict. They kind of spasm. See the ridges here, where it was nice and smooth here. You've got an inflammation going on because something has triggered the asthma attack, so you're going to have increased secretions. Those secretions get to be thick, and so that adds to the inflammation and the cause for the student not to be able to take in a deep breath. Here's a different view of the airway when a child is having an asthma attack. You see the mucus that's building up, so it makes the airway even smaller. A way to think about this is a garden hose. You can breathe in nice and deep with the garden hose. Think of this without the mucus as a straw, but once the mucus builds up, think of a stir stick. So how would you feel trying to breathe through a stir stick? It's really difficult to do that. This is just another view to show how the lungs are affected. You're going back through here. This is the left side of the chest on the left lungs. So it breaks down even further into the alveoli and the bronchial. Those get filled up with the mucus and they'll constrict also. They may be about this size once a person has asthma attack. It's very small, very thick, and that's how you can take a deep breath. It opens and expands, but with asthma, it constricts and you can't open it up very well. So, just some information that I had said before. The airway carries the air into and out of the lungs. When you have asthma, that whole airway process is inflamed. It gets swollen, it gets constricted, and it's just difficult to breathe the whole time. Sometimes the airways are constricted because they've inhaled something. Like I said before, that it's an environmental factors that can trigger an asthma attack. Just things that I've already said about that. The mucus is sticky, it's thick, and it narrows the airway even further. Here's some signs and symptoms that we would be looking for with the students. If they said they've been up all night coughing, or they got up this morning and they're coughing, and it's just a constant cough. Sometimes a cough is the first sign before you can actually hear the wheezes in the child. So you need to go ahead and assess them and check their O2 sats. The wheezing, sometimes you can hear them before they even walk into the door. It's a squeaky sound. Once you get to listen to that, it's almost like a sound. Crackles are like tissue papers, and you'll hear those also. Sometimes the kid says that their chest feels tight, and that's because they're having a hard time taking a deep breath, and so it's just putting pressure on their chest. It's not like a heart attack, but it's just hard for them to breathe. They're short of breath because they can't take a deep breath. Things that trigger the asthma. Right now, we've got the cotton bean gin. That'll trigger off the asthma because it's in the air and it's an irritant to the airway linings. Animals, cockroaches, mold, dust mites. Sometimes asthma is more seasonal, like when the trees are blooming and things like that, you'll see more kids with asthma attacks. Irritants, cigarette smokes, air pollution, chemicals if mom's been in the room, or if environmental services has been in the room and they've just cleaned it, that cleaning products, the air that's picked up and circulated back in the room could cause somebody to have an asthma attack. Also, the same thought with that is your perfumes, candles. We need to be asthma friendly with our kids in their classrooms. So no heavy perfumes, no scentsies, no candles, no room sprays. It just needs to be a plain room without any scents. Medicine, asthma, no, that's not right. Medicine and sometimes asthma, aspirin, and non-steroids medicines will irritate the airways. It's a beta blocker, and it doesn't work well with the medications, inhalation medications that the students have. If a kid or somebody in the family has been sick and has had a cold or an upper respiratory infection, that virus or bacteria will get into the kid that has asthma attack and irritate them more. Physical activity is one thing that we need to prevent on the kids. when it's really cold outside, those students that have asthma will have more difficulty breathing, so we need to make sure that they get their medicine ahead of time and let them go out. If that cold air is too much for them because they're breathing it in, they're having an asthma attack, and it makes the airway constrict even more, then we need to see if the coach will let them do something inside instead of being outside. So what we need to do is education. We need to talk to our kids about what actually triggers your asthma attack. They know what triggers the asthma attack, they just don't think about it. Then we need to talk to the teachers, the principals, even the parents about the environmental factors that can trigger an asthma attack. A smoker, their cleaners, the dust or the dust mites that might be in the room. The nurses have not always had the capability of talking to the primary care physician about setting up an action plan for these students. My intent at the end of this is that they'll have more communication with the primary care physician. They'll actually do a better action plan for our students. We'll have step by step what we can do for the student. I feel that once they do that, they'll be able to communicate better with the parents about what we're going to do for them at school, but what a parent needs to do for them also. Once we have the action plan, those students, teachers need to be informed what's going to happen. If a kid starts coughing, or if he comes in the room and somebody has sprayed perfume, then the teachers need to be aware of their environment and make sure that the student with asthma can step out the door or go to the nurse's office because there's an irritant in the room that's going on. Then when something like that happens, of course, we always have to communicate with our parents. Here's the forms that we currently have. They're great forms, but I don't think everybody is doing the process like we would like to do. So we'll just briefly go over the forms. This is our asthma management plan, where we have our physician to sign. Here's his part that needs to be filled out. So the student has asthma. What do we do and how often and when can we do this? Mainly a bronchodilator. That would either be the inhaler or the nebulized treatment. How often we can give it, how quickly can we give it, and what dosage, can we go up on the dose, can we repeat it more than on the nebulizer and the inhalers. Most of the times they say only every 4 hours. If somebody's really in a crisis, can we repeat it once or twice, wait again, and then give you a nebulizer treatment? This is what the physicians are telling us. It's not as good of information as we need, but it's better than nothing right now. Physician signs it, the parents sign it, and up here gives us permission here to actually talk to our physician. Here's just a general information sheet that we give our teachers. It's talking about asthma, that it's a chronic childhood disease, and saying what happens. They get hard of breath, have a difficult time breathing. Their lungs feel like they can't breathe in, or they can't breathe out. Here's a list of some triggers, so that way the teachers can help avoid having these triggers in the classroom. And here's some quick signs and symptoms, early signs: the coughing, the chest tightness, the throat feels like it's getting tight, and they're breathing through their mouth instead of their nose. Late signs that the teachers would hear, but I hope they send them already to us, are wheezing, shortness of breath, and then their respirations get quick. Here's an extreme weather condition policy that we have. We're just trying to get the teachers and the PE coaches aware that asthma can kill. We want those students that have acute asthma to be given indoor physical education. If it's really cold, they need to go inside. They can't go outside because it does tend to irritate the lung lining and just makes it worse for them. Our medical consultant has worked with the pediatricians and they are good with this. It's just we need to make sure that we have educated our coaches about this. Here's just information that we give all our students that have inhalers. We send it home to the parents. It's just a reinforcement on how to use an inhaler correctly. Most of the times the students say, oh, we've been taught, they shake it and they squirt. Well, that's not the right way to do it. They've got to shake their medicine, take a deep breath in, blow it out, then squirt, hold it in their mouth for like 10 seconds, and then breathe nice and slow. That way the medicine gets into the lungs, it's starting to work. Wait a couple of minutes after that and do it again. Here's our actually emergency action plan that we have in place. It's better with the steps for our physicians to sign it. You know, they're doing well, what kind of medicines that we take, how often and when can they take it. Here they're getting a little worse. They've got the cough, they've got the wheezing, they say they didn't sleep much last night. What kind of medicines can we give them right now that'll help them? How often and when can they take it? Here's our medical alert. We've done our inhalers, we've done our nebulized treatments. They're really having chest pains, and you can tell that they're kind of bent over and they're having a very difficult time breathing. What kind of medicines can we give? And then we call 911. In this phase also, we want, what should the O2 sats be? Sometimes some physicians think 90. Well, is that child compensating, and is 90 really a good one? Or is it mid-80s? We need to have a little bit more specific parameters. Here's our individualized healthcare plan. It's a cookie cutter. We fill in the information for this student on asthma. Here's what we expect. Here's what the nurse is supposed to do. She's supposed to know about the student. She's supposed to provide the medicine in a timely manner and make sure that the teacher knows about it. Here's the second page with it. It's okay, but I feel like it needs to be, from the literature that I've read, it needs to be more student specific instead of just a general one thing fits everybody. So of this project that I did, my proposal is that we do a school nurse asthma care check sheet. In this check sheet, it's not really about the medicine and about how to assess the patient. It's making sure that everybody is on the same page, on the same time, treating the asthma. We need to make sure that we get our health history, that we have our diagnosis, that we know what our outcomes are going to be. Short, intermediate, and long-term outcomes. We need to make sure that we have this on every student every year. It needs to be included in the student's IEP, which is an individual education plan, or 504, which is other healthcare impairments. We need to start this plan, we need to update it when things change, and then we need to reevaluate this at least every year, but we need to make sure that our parents are involved with the evaluation. Here's one of a student that hasn't been diagnosed. We need to make sure we can get the information, talk to our teachers, talk to the parents, try to get them diagnosed as asthma or at least know that they do have problems. An asthma-friendly school, we want to make sure that the teachers know what needs to be done, that we're smoke-free, that we don't allow perfumes and candles in here. This is my proposal that we implement this care plan, and I thank you for your time. Here's just some of the references that I used to get this information. There's not any questions?
I do have one.
Okay, pardon me? Yes, sir.
Kids with asthma, how do you find their home life? Is their home life a clean home, pet-free, or do you find it quite the opposite?
Yes and no. Sometimes their homes are clean. Most of the time they all have pets. So that is one of the irritants with them. Sometimes the parents aren't even aware of the triggers for the asthma. So sometimes they're clean, pet-free, wonderful. Sometimes they're not as clean as they need to be. They have pets. So with this plan, we need to communicate better to the parents.
Okay, thanks.
Thank you.